Namaste everyone, this is Dr. Vaishali Lokhande, consultant physician at Apollo Hospitals, Navi, Mumbai. Let's understand a bit about mouth sores today. Mouth sores or oral ulcers are lesions appearing on the mucosa of the oral cavity. They could be anywhere on the inner surface of the cheeks, on the lips, on the tongue, on the soft and the hard palate, as well as on the gums. Usually these are ulcer-like small lesions ranging anywhere from few millimeters to few centimeters, and they can appear as painful lesions to begin with. Painless ulcers usually do not happen in the mouth cavity, and they are a source of agony and trouble for the patient. Oral ulcers, we might think are non-serious. Usually they are, but at times we have seen that some oral ulcers are a harbinger or indicator of something serious happening in the body. So let's understand which oral ulcers are non-serious, what could you do about it, and which ulcers need to be seen by a clinician or a doctor and need to be investigated. So usually most of us have seen when we have been through exam stress, through periods of acute illness, we have been through some major viral illness or been through a course of antibiotics for some hospitalization, we have ended up with oral ulcers. So these are stress-induced ulcers or aphthous ulcers as they are called. And usually these are because of change in the gut flora or the gut bacteria that are supposed to be residing in our bowels. Now when the gut bacteria change from the healthier to the non-healthy version, the ulcers can become worse. Usually these respond to a course of B-complex, zinc, multivitamins and a course of B12 folic acid along with probiotics commercially available. Most of us have also seen that some women tend to have ulcers when their menses are due, or women suffer from this during the pregnancy. Students suffer from it during the exam periods when they are staying awake late at night. Sometimes it may happen that a person who's into too much of smoking and alcohol can have oral ulcers, and usually these respond to, of course, supplementation and also changing the lifestyle to a more healthier way. Usually these things settle and do not recur unless the triggering factor which was there in the first place happens again. But here there are some conditions where the ulcers do not go away, come what may, and probably then we need to investigate them in depth. There are conditions besides these two, like B12 deficiency and folic acid deficiency, which also can cause oral ulcers. So B12 is a vitamin which is required for our brain functioning, for our nerve functioning, and also for our red cell health, and also for our gut health. So when there is B12 deficiency, either because of a problem with our food choices or food intake, or because the gut mucosa cannot absorb B12 because of some deficiencies like intrinsic factor, in such cases also the ulcers can happen and do not settle despite medication and may require long-term treatment. Besides this, there are conditions like autoimmune disorders, meaning where the person's immunity which is supposed to protect the person, can become self-destructive and affect the mucosa of the mouth, and may also affect other organs of the body like the joints or the kidneys or the skin. So these are autoimmune disorders, the commonest example being lupus or SLE as we call it. These people can present with recurrent mouth ulcers. In addition to that, they may have hair fall, they may have rashes in the skin may turn dark on exposure to the sun, and they may have, in addition to all that, maybe joint pain and swelling, weight loss which is unexplained, low-grade fevers. So as I said, simple ulcers which are settling with few medications and not recurring, you can try over-the-counter medications and usually things are fine. But some ulcers, usually the kinds which happen to go on for weeks or months, or which recur with every month, or ones which are causing so much difficulty that the patient is not able to maintain his or her nutrition, and as a result they end up with weight loss, they end up with multivitamin deficiencies, and they end up with poor gut health. These people are the ones who require investigation. These are just, again, maybe I may say the moderate or the slightly more serious causes. Beyond this, there are some conditions like malignancies of the oral cavity. Even the presentation could be a non-healing ulcer. So when do we think of these things? A person who has had a fractured tooth, or maybe some dental treatment which has happened and has resulted in a deformity because of whatever reasons, and the patient develops an ulcer and it does not go away despite all the supplementations, they may also require investigation in the form of biopsy of that affected area to see whether it is just a simple ulcer or something more sinister inside it. So in which conditions should you see a doctor? You've tried your regular supplements from over the counter. You should also try probiotics. Probiotics are commercially available over the counter, or of course you could try the good old curd from the kitchen, the yogurt, which should help. Make sure you're eating your source of vitamins from the kitchen. So having your fruits on a regular basis, having a good amount of dals and leafy vegetables which will add to your vitamin sources should take care of your daily requirement in normal health. But when you're not well, these are not going to be enough. You may require supplements commercially available. Any combination of B complex and zinc in the right proportion, maybe adding a bit of vitamin C to it to improve immunity, and also B12 supplement available orally, commercially, along with folic acid combination can be tried. Usually 2 weeks of therapy should take care of simple, non-serious conditions, and the patient should be able to have total clearance of all the ulcers and resume a normal life. But supposing the thing is not clearing, or if it is recurring again and again, it's time you should see your doctor for advice. Most of the times, if it's not working, the doctor may try investigating the patient for maybe basic tests like CBC, ESR or CRP to see if there is any underlying chronic condition. A good look at the oral hygiene and other causes, good look at the dental structure, whether there's any deformity or any treatment going on for the same. Sometimes a simple thing like a very strong flavored toothpaste which has a lot of cloves or spicy items in it, or allopathic products or alternative medications which are being consumed for other reasons, they could also be the cause of ulcers, and they have to be, of course, the doctor will take a good history and find it out and stop it. And many of the times, once the interfering agent has been taken care of, the problem may resolve. If it doesn't, ultimately, the extreme cases, the investigations may be required. So here again, disclosing to your doctor everything, whether you have weight loss issues, whether it's because of your diet, food fads, or it's unexplained weight loss without any control over it. Do you have any anorexia issues? Because even that would result in poor nutrition and ultimately ulcers. It could be one feeding the other. Poor nutrition causing ulcers and constant ulcers causing poor nutrition. So these things have to be looked into. Any hair fall unexplained, any joint pains, any skin rashes, any autoimmune disorders in the family, tobacco abuse, smoking, which is of course not healthy, even that will breach the gut, the oral mucosa, and alcohol intake. All of these could be one of the triggers, and they have to be curbed or controlled before we can take any action. So in extreme cases, the biopsy may be required if the doctor feels that it doesn't look like a simple ulcer. And there have been few unfortunate cases where the patient has been ended up with diagnosis of a borderline or a possible malignancy. So before I give my parting shots, I would like to mention one important thing, an adage as I have learnt as a student in my graduation days. The oral cavity is a reflection or a mirror of the person's health. In fact, just to look at the oral cavity and we have picked up many good conditions from the person's health, like lupus, diabetes, liver conditions, kidney conditions. So all these can be picked up by the patient's oral mucosal health and the odor of the breath. So we need to understand that it gives a good idea of the person's general health. We need to be careful about what we choose as our food products, what are we using as oral care products. Sometimes astringents being used may not be the right types for your kind of constitution and may end up hurting more. Very strong toothpaste, all these have to be avoided. Stay away from alcohol, stay away from smoke. These are definite toxins and no-no for your oral health. Multivitamin supplements, B complex, zinc and B12 folic acid intake in the right proportion should be a good idea. Some people may have problem with absorption of B12 and folic acid because of their inherent constitutional problems. They may require injectable supplements. Make sure your gut health is good. Avoiding unnecessary antibiotics because they also will change your gut flora. Taking probiotics from home or from the chemist store would be a good idea intermittently in case you are suffering from mouth ulcers. If all this does not seem to work, please see your doctor at the earliest and take care of your oral health and in charge of your health for good. Stay safe. Goodbye.